Hi, and welcome back to Type 1 Diabetes Explained. Today, we're going to talk about caring for your skin while managing Type 1 diabetes. If you have Type 1, then your skin is probably going to be undergoing a lot of stress, from insulin injections to blood sugar tests, CGM insertions to pump infusion sites. There are lots of needles that will be going through your skin, and if you aren't careful, this can cause damage to your largest organ. In this video, we'll talk about several strategies to help ensure that your skin stays healthy. First, the most important thing that you can do for healthy skin is to rotate the sites that you use for diabetes care. Whether that be drawing blood for a glucose test, injecting insulin, or installing a pump or CGM, it's very important that you don't use one spot over and over again. But you might be wondering why. It seems like it would be a good idea to concentrate all the damage into one little area and leave the rest of the skin untouched. Well, if you repeatedly inject in only one area, then that section of the skin can become damaged and you are likely to develop a condition called lipohypertrophy. Lipohypertrophy is a condition where lumpy fat tissue builds up in areas that undergo repeated injections. The main reason that this occurs is due to the reactions that insulin triggers in your fat cells, which causes them to create more new fat cells than usual. In fact, when looking at the word lipohypertrophy, the root lipo means fat, the root hyper means over. You might remember that from being hyperglycemic, which means that your blood sugar is over what it's supposed to be, and the root trophy means nourishment or food, so the entire word together means that the fat cells are becoming overnourished. This condition is most likely to occur on the thigh or the stomach, since those are the most common spots for insulin injections. Lipohypertrophy is a section of the skin that is firmer or harder than the surrounding tissue, and it may appear lumpy, raised, rubbery, swollen, or thicker than the skin in that area used to feel. Not only does this mean that your skin has been damaged, but it also poses a problem for your diabetes care, since it is harder for insulin to be absorbed into the body through these areas. This means that even though you may inject enough insulin, it may not be able to be absorbed fast enough to be effective, and you are at greater risk of hyperglycemia. Data suggests that up to 62% of people with diabetes, either type 1 or type 2, will get lipohypertrophy at some point during their lifetime. And you might be wondering, why is this condition so common? Rotating your injection sites to prevent it seems pretty easy, right? Well, not only are humans creatures of habit, but if you find a spot to inject that seems to hurt less, some people might be tempted to continue using that spot to avoid pain. Studies have shown that lipohypertrophy can occur regardless of what method you use to inject insulin, whether that be through a pen, a pump, or a syringe, and that the best way to reduce the chances of it occurring is to make sure that you rotate your injection sites. Although this condition can definitely cause you some problems, it does often improve over time if you leave the affected skin alone. There's another important rule regarding injections, and that is to never share needles or use them more than once. Since needles used for injections, as well as lancets for blood sugar meters, go inside or under your skin, they are really easy methods for infections to enter your body. This is why you should never use a needle that anyone else has already used, as that is a prime way to transfer really serious illnesses from one person to the next. This also applies to insulin pens, because even though it may seem like it's safe for you to use a different needle, sometimes a little bit of blood or other bodily fluid can leak back through the needle and into the insulin reservoir. This is not a big deal if only one person is using the pen, but if you decide to share, you could potentially be injecting one person's bodily fluids into another, which can lead to infection or other serious bloodborne illnesses. Another potentially dangerous practice that people don't often recognize is using the same needle over and over again on yourself. It might seem logical that since you're the only person using the needle that it's okay to use it more than once, and while this is less dangerous than sharing it with others, there are still some risks that you should be aware of. First, the risk of infection still exists, since needles sitting outside of their sterile packaging can pick up bacteria, viruses, or fungi from the surrounding environment that might hitch a ride into your body the next time you use it. But there are additional risks beyond just infection. As a needle gets used more and more, the fine tip can become more blunt or distorted, and studies have shown that reused needles often cause patients more pain both while injecting and removing the needle than when using a new needle every time. The dull or damaged point can also cause more damage to your skin. This repeated stress on the needle due to reuse can also cause small portions of the needle to break off inside your body, potentially leaving microscopic, and sometimes much larger, chunks of metal under your skin. Obviously, these aren't good things to happen, and all will negatively affect your skin health. So, using a new, sterile needle for each injection is the best choice to keep your skin healthy. There are also several skin conditions that can be caused by type 1 diabetes itself, and many of them occur as a result of neuropathy. Neuropathy is a word used to describe damage or dysfunction in your nerves, which can cause numbness, tingling, muscle weakness, and pain. Neuropathies will often first appear in your hands and feet and work their way inwards, affecting other parts of the body, which is why they are often referred to as peripheral neuropathy. So, what causes neuropathy? Well, several things can damage your nerves, but when looking specifically at diabetic neuropathy, high blood sugar levels and high levels of fats are the main things responsible for causing neuropathy, and these factors can also weaken your immune system and lead to damage of the small blood vessels that help provide your extremities with nutrients and oxygen. This damage and lack of nutrients makes your skin more prone to a variety of bacterial and fungal infections. But the more important thing to know is how to reduce your chances of getting these infections. As always, keeping your blood sugar under control and in range is the best possible step to reducing the likelihood that you will develop diabetic neuropathy and any of the subsequent infections. Additionally, it's important to keep your skin clean and dry, which may involve avoiding very hot baths and showers, using moisturizing soaps and skin lotion, except between the toes, the extra moisture can cause fungal infections, and treating any cuts or scrapes that you get right away. If you have specific concerns or need help keeping your skin healthy, see a dermatologist, a skin doctor, and they will be able to help you stay healthy. Hopefully today's information was helpful and you learned something about how to keep your skin safe and healthy while managing your diabetes. Thanks for watching, and as always, have a great day.